So, welcome everyone. Super excited for this month's virtual pre-pharmacy club session highlighting the dynamic and diversity field of clinical pharmacy. So, we're joined by three panelists who will be sharing their experiences, but we also want this to be interactive. So, during their share and after, please feel free to raise your hand, take yourself off mute. But if you have to, you can utilize the chat. Both myself and Dr. Rose will be monitoring the chat. But again, please ask questions, engage. This is your time to really expand your knowledge or maybe even learn something new as you all are considering the pharmacy program here at Temple, but also what capacity you want to serve as a future pharmacist. And I think this panel will be very dynamic and it will open everyone's minds up to just other areas in which pharmacists are serving. So, super excited, and we will kick it over to our first panelist.
Hey everyone, sorry I was muted. My name is Noor Kazaz. I am a clinical pharmacy specialist for Temple Lung Center, and this is my career path in pharmacy. We can go ahead to the next slide. So, when I was an undergrad, I wanted a degree that I would be able to fall back on just in case I was not successful in getting into pharmacy the first time around. So what I did was I majored in chemistry and I minored in medical diagnostics. I knew that that would give me a career that would could be adjacent to pharmacy. So after that, I wanted to combine obviously my love for chemistry and being able to work with patients. And so then I applied to pharmacy school. And while I was in pharmacy school, I realized that I wanted to do clinical pharmacy. So I completed a pharmacy practice residency. And then after I completed my residency, I staffed as a staff pharmacist for 2 years, and then I transitioned into my clinical role. What was important for me was to get more experience all around before I become specialized. So that's why I staffed for 2 years after my residency, which is not always traditional. There are those who go to residency and then go right into the specialty, but I decided to staff first just to get more hands-on experience and more global experiences. We can go on to the next slide. So, as a pharmacist, I like being the medication expert among the entire staff, and I enjoy creating workflows with my clinical knowledge and optimizing the Epic systems. So, Epic is the way that we utilize our electronic medical record at Temple University. So, I take my clinical knowledge, I create workflows, and also implement them into our Epic system. And I really like adding my clinical knowledge and then making it operational so that it can be used by the end user, which would be my providers, my nurses, medical assistants, whoever needs to use the systems that I've created. While I was a pharmacist at the Lung Center, I appreciated knowing how to treat patients, but a lot of our patients had different barriers. A lot of our patients come from different socioeconomic classes, so I decided to go ahead and get a master's degree. And I earned a master's in public health with a focus in social and behavior sciences. So now not only did I know how to treat specific patients, but I knew what barriers came with different patient populations and how to address those. And so these together, public health and pharmacy, really allowed me to optimize patient care. And now I can create improvements within the health system and really go beyond just my clinic. For example, during COVID, I really helped the entire health system create COVID vaccine clinics, and COVID infusion clinics, as well as help the team overall. And that was inpatient, despite the fact that I was an outpatient ambulatory care pharmacist. And I think all my experiences really helped me adjust and operationalize different things with my clinical knowledge. We can go on to the next slide. So my current role, more on my current role, is I am the lung center pharmacist for 3 practice sites, but I have almost 100 providers. So when I say providers, I mean doctors, nurse practitioners, and fellows who are in their learning programs. The patient population from a disease state perspective is patients who have advanced lung disease. These are not patients that have general asthma. These are patients who have asthma that has not been treated or that they cannot be controlled. These are patients with rare lung diseases as well. So the patient population of advanced lung disease. My key responsibilities are I create epic builds and systems and workflows to optimize clinical care. I also manage inboxes. So for when patients have questions to the lung center providers, I offer the pharmacy support, and a lot of times I answer the questions on behalf of the providers, or if there are adjustments that could be made on a pharmacy level, I have an agreement with my providers where I can just make those adjustments. I don't have to worry about a provider going in and okaying my adjustments. I can just go ahead and do it. So if a patient goes to the pharmacy and an inhaler can't be filled and they would like something as a formulary alternative, I can use my judgment and go ahead and change that therapy. And then 2 days during the week, I play a role in an interdisciplinary team where I work with nurse practitioners, an attending research nurse, and coordinators and surgical coordinators. And we all work together to treat the patients. So some of these patients might need to be started on a new therapy, enroll in a clinical trial. And so we give them a multidisciplinary approach to their care and to help increase the patient satisfaction. So even if the provider writes for a medication or wants to discuss a medication therapy, I go in and kind of demystify a lot of things about the medications and simplify like what it means to pick up your medication from the pharmacy, what your pharmacy benefit is, and tell them how this medication works within their disease state and what are the things that we're going to be looking for to monitor. And so a day in my life is basically I mix clinical care, system design, and collaboration with providers and other team members. And that's it.
Thank you so very much. One thing I want to point out, as you highlighted, going back and getting your master's in public health, I'm happy to share that we started a program where students can get their dual degree in PharmD and their master's in public health. And you can see firsthand why and how it's so important to have that skill and that background to further continue to support your patients and have an impact. So thank you so very much. And if you guys have questions, start thinking about those questions now. You can put them in the chat, raise your hand, and take yourself off mute. But as you're thinking and formulating those questions, we'll move on to our next panelist.
Sounds good. So, hi everybody. Just to introduce myself, my name's Kevin Lee. I was a Temple student. I am now one of our clinical pharmacy specialists at Temple University Hospital in abdominal organ transplant. So, my path to being a pharmacist started working at CVS. When I graduated high school, I kind of decided I really want to know what I want to go to school for before I put all of that money into college, right? So I decided to work at CVS and I was there for 5 years, working my way up from a technician to a lead technician. And then eventually I decided, hey, I want to go to pharmacy school. I want to progress my career. So I actually entered pharmacy school thinking that I wanted to do outpatient pharmacy or retail. Um, Once I got into pharmacy school in 2018, I got a job to try and kind of broaden my experience, but as an outpatient pharmacy intern at Penn Presbyterian. So servicing patients who are being discharged from the hospital, for example. And it was at that time that I started to develop an interest in clinical pharmacy. So I really couldn't make up my mind in pharmacy school. It's okay if you haven't made up your mind right away from the get-go, because my path to transplant didn't start until my appy rotations. I actually wanted to be a retail pharmacist first, then ambulatory care as soon as I had my first ambulatory care class, then infectious disease because I thought that was really interesting, and then oncology. So I think I changed my mind about 5 times before I had my transplant appy and then decide, wow, this is incredible. This is kind of what I want to do for the rest of my life. And with that in mind, I chose Temple University Hospital for my PGY1 residency because I knew that they offered a really wide range of transplant experiences as well as a second year residency in solid organ transplant. So from 2022 to 2024, I was in residency. I spent both years at Temple University Hospital. My first year was, of course, a general year, and then my second year was in solid organ transplant. So I got full training for both kidney, liver, pancreas, as well as lung, because we're the largest lung transplant center in the US, and heart transplant and mechanical circulatory support. But ultimately, my love was for kidney transplant. And I was fortunate enough that a position opened up at graduation in 2024. So I was kept on as a member of our abdominal organ transplant team, and I've been in that role ever since. Next slide, please. So, just to kind of introduce you to the concept of transplant, I know it's incredibly foreign to most students, and that's totally okay. There's basically solid organ transplant and there's liquid organ transplant or bone marrow transplant. And when we say solid organ transplant, that can be further subdivided into people who deal with abdominal organ transplant, which really refers to all of your visceral organs, so kidney, liver, pancreas or islet cell, and intestinal transplant, or cardiothoracic, so whatever's in your rib cage, right? Like the heart and the lungs. I much prefer abdominal organ transplant, and that is my current role. So, what's kind of unique about transplant pharmacy is how involved you are in all phases of care. For someone who kind of couldn't make up their mind like me, or if you want to say it more nicely, had a very diverse set of interests, right? And wanted to both work in the acute phase for patients who are very critically ill, but also wanted to have like long-term follow-up for their patients in the outpatient clinic. Um, this was kind of perfect. So, as a transplant pharmacist, you interact with both an ICU level of care for these patients who have, they're incredibly sick and they need a transplant urgently, or they've been transplanted and they're in the surgical ICU and you're managing them while they're still very sick and recovering, all the way through to the ambulatory care setting where you can kind of follow up on them long term, and really get involved almost like primary care levels of care and follow up. And then their readmissions, which are quite frequent because they're still a very frail population afterwards, kind of fulfill that niche that I enjoy with acute care as well. So the other thing that's unique about there are transplant regulations by Medicare, CMS, and OPTN, which runs transplant in the US, that require the involvement of a pharmacist with the team. So one of the things that I really enjoyed throughout my training was the contra mantra of you're going to have job security because every hospital that has a transplant program is required to carry at least one pharmacist, and most of them carry multiples. Just in general, transplant patients really represent this unique, complicated patient population. You have to be good at both like primary care, so all of your basic disease states, hypertension, diabetes, all of those things. But you also need to be good at immunology, infectious diseases. There's a lot of overlap with oncology. These patients are just totally atypical compared to any other patient population. So I just thought it was really, really interesting and fell in love with it. The kind of interests that lead you into this field of specialty, obviously, if you love anything to do with the immune system or immunology, then this is kind of going to be your number one specialty, along with oncology and HIV care. It's a core concept for us. Pharmacokinetics, because there's so much therapeutic drug monitoring involved, and there's so much that changes about the way people absorb, metabolize, excrete drugs post-transplant. That's really just one of the things I deal with every single day with my job. It was also one of my favorite classes. The amount of patient interaction that you're allowed to have. So both in the pre and the post-transplant setting, being able to work patients up for evaluation, as I'll mention on the next slide, as well as just the ability to kind of see your patients recover and then follow them for years and years afterwards, ideally, and build a relationship with them. That's really important to me. My coworkers joke that I like to talk to strangers because it's kind of my favorite thing to do in clinic. And then just the versatility, like I mentioned, you have to have like a very broad skill set to succeed in transplant. And I enjoy being able to apply pretty much everything that I learned in pharmacy school. Next slide, please. So my current role at Temple is actually split between the inpatient that is in the hospital and the outpatient setting that is the ambulatory care clinic. I switch with my partner, Adam Diamond, on a monthly basis. So one of us is always in one setting, and then we kind of switch on and off every month, which keeps things fresh. On the inpatient side, we round with the transplant surgery team on patients who are urgently readmitted or patients who have just been transplanted. But I also follow all of the patients who have been readmitted who have ever received an abdominal organ transplant, just because the providers who are taking care of them may not be comfortable with all the complex medications or drug interactions or all the management that goes into those people. So they really appreciate having an extra like consultant on hand. I also do evaluation for patients who are, how do I put this? They really urgently need transplant, and it's very likely that they're not going to leave the hospital unless they get one. So there's no time to wait until they get discharged into the outpatient setting. So patients who have, for example, gunshot wounds to their liver, or patients who have acute alcoholic hepatitis and they're likely to expire within, say, like 7 days, I need to do an urgent evaluation for them on the inpatient setting. In the outpatient setting, I service two different clinics. So I do the transplant surgery clinic, which takes care of our patients within the first 30 days, and then the transplant nephrology clinic, which takes care of patients from 30 days and beyond. So those clinic lists are usually quite long. I don't have as many providers as Noor, but I usually have about 20 to 25 patients a day. In the outpatient setting, one of my key responsibilities is working patients up for transplant. So we'll call them, do a full medication reconciliation, do a little bit of patient education, and then we'll kind of take any findings that we have that are concerning to a listing committee that decides whether patients are going to be eligible for transplant or not. There's a lot of longitudinal care. So we have meetings with our providers to take care of patients that, for example, have organ rejection or developing infections, and they need a lot of close long-term monitoring. I'm available as a clinical consultant to all of our providers, so I spend a lot of time answering Epic messages all day for weird transplant-related problems, of which there are many. And then I kind of fulfill my enjoyment for developing protocols by helping write like our medication usage protocols for some of the infusions that we do, how we're going to manage rejection cases and things like that. So it's a pretty diverse role. I get to do something new every day and I get to switch off every other month. So I really enjoy it. But that was my path to transplant pharmacy. So happy to answer any questions you have. Thank you.
Thank you for sharing. And also, thank you for your transparency of not knowing. Some of you were able to join us last Saturday for our open house where, we spoke about IPI, which are your introductory pharmacy practice experiences, and then the API, which are your advanced pharmacy practice experiences that will happen all throughout your matriculation through our program. And it is okay not to know. And Kevin, is a living testimony that it is okay not to know because although you may come with experiences or you may not, we really want you to come in so you can absorb everything and all of the experiences. So then you can really figure out along the way what your interests are, what your passions may be, and also how they may change and adjust as you grow and learn throughout the program. So don't come in thinking that I'm only doing this and I'm doing that and that's it. There could be an experience that can change your life, and lead you to doing something that you didn't know that you were good at and or passionate about. So thank you, Kevin. And we'll move on to our next panelist.
Hello, everyone. My name is Akili Martin. This is my path to pharmacy. I currently am an anticoagulation and ambulatory care pharmacist. Next slide, please. So I am what you many would call I took the non-traditional route, if you will, to pharmacy. I worked as a certified pharmacy technician for 12 years. Now that I think about it, it's 15 counting my retail experience. So, extensive history with working as a technician prior to graduating pharmacy school. I worked full time actually while I earned my associates at Deltec. And at the time, I'm not sure if that's still true, but at the time, my credits had transferred over to Temple. So I was able to do is what they call a 2+4 journey into pharmacy. So during my time at Temple, I was very involved on committees in the TUSP community. I knew that I wanted to do a residency post grad, so it was very important to me to stand out and look like a well-rounded candidate for these residencies, even with my extensive pharmacy experience. Um, I matched at Penn State Health St. Joseph in Reading, Pennsylvania for my PGY1 post grad year. Um, Next slide, please. Okay, so currently, my role as an ambulatory care clinical pharmacist. Right now, I'm specializing in anticoagulation clinic. It's embedded in one of the largest healthcare system hospitals in Delaware. Primarily, we manage chronic disease states and optimize therapy for patients' blood thinners. If the patient has an indication to be on a blood thinner, whether it, be the brand name, they call them DOACs or warfarin, the oldie but goodie. I'm the pharmacist embedded in the clinic, and there's five cardiology clinics within the healthcare system, but I man one of them. So I have my own set of patients that I see day in and day out. But it is multidisciplinary. So it's a pharmacist run clinic, but I direct medical assistants, office assistants, and work with the nurse practitioners and the other providers to work as far as the whole approach, not just the patient's blood thinner or warfarin, but I counsel patients on other things as well. My favorite part, though, is precepting pharmacy learners. So currently, I have the lead role in precepting PGY 1 and 2 pharmacy residents. Also, IPI and API. So that's introductory and advanced pharmacy practice experiences. So I precept all of those students throughout the year. Next slide, please. So some unique opportunities in pharmacy. As we know, social media is taking over, right? So I one thing I wish someone had told me early on is that pharmacy is just so much bigger than what you see in school and even in your appies and ippies. For me, I was able to merge my clinical background with content creation and health education on social media. So these actually open the doors for brand partnerships. I do community outreach. And I really have a passion for helping people understand their medications in a relatable way. Like I mentioned, I love mentoring and precepting students and residents. So I'm able to teach and mentor these learners. And I think for me, that's one of the most rewarding things as in my career right now. So I would say that my community involvement has led the way to new clinical initiatives. I'm on many clinical committees as far as creating new protocols and things like that for the healthcare system. But I also take my relationships and things like that and give back to the community as well. That's really important for me. Um, so on a broader scale, I guess ultimately, any advice for people who would be interested in pharmacy as a future career, don't box yourself in. Pharmacy has so many lanes, and you can truly create your own path as it fits to your strengths, your personality, and your passions. So seek mentorship. That's a biggie. I had a lot of great mentors along my way in pharmacy school. Dr. Rose is one of them. And even after, I still keep in contact with some of my mentors from pharmacy school and my appies and my ippies. So pharmacy is a small world. I'm pretty sure this is not the first time you heard that. It's a small world. So you definitely want to seek your mentorship and remember your why. Why are you starting? We get in it to help people, right? But there's so many different lanes, as I explained, that could feed your passions and make the job fulfilling, not just, clocking in every day. So I'll be happy to take your questions.
Thank you. I love one because you shared about your path into pharmacy. Oftentimes, we actually, and we still have the pathway, the 2+4. So if you are seeking this, which we call more an accelerated pathway, you do have that option for our prospective students. As you're thinking about, where you want to go, we have a few partnerships with a few community colleges where you're able to complete your prerequisites. And even if we don't have a partnership with them, we'll look at your transcripts and and see what will transfer in and what will satisfy our prerequisites to dive directly into our PharmD program. In addition, I love, Akili, how you shared your passion outside of what you're currently doing and how you're able to tie it all in. And I think that's the cool thing about pharmacy. I was that student that loved science but didn't know what I wanted to do with it. I'm like, well, how come no one told me about pharmacy? Because I just think it's so cool that you're able to tie in so many different disciplines, but then also different passions to still have an impact and love what you do. And as you can hear, just the dynamic and the diversity within the field. And this is just within the or under the umbrella of clinical pharmacy. You see the different pathways within. So, the path or the pathways of pharmacy in general are so vast. Really don't lock yourself in or box yourself in, as Achilles said, I'm only going to do this. It's so much more out there. And just with our three panelists alone, we were able to hear just some of the few pathways and the cool things that are going on in pharmacy. So thank you very much. I definitely want to make sure that we get some hand raised, some folks off mute, maybe asking specific questions to their pathway or new interest that they didn't know that they had. We're a friendly group, so you don't have to be shy. I'll start as hopefully someone will jump in. Maybe what was something or not something, what was, I guess, the hardest part of pharmacy school, and how did you overcome it? If it was a self thing, if it was an external thing, what were some of the skills that you were able to apply to get through that tough part or that toughest part of your journey?
Um, Mine's kind of embarrassing, but I fell asleep during an exam. And when I woke up, I bubbled in the questions. Like, I was like one answer off each one, and I failed the exam. And I went to the professor, and I was like, do I not know anything? And then I realized my sheet compared to, I had like literally done the whole thing wrong. And I panicked, but what I did was like tried to like really focus when I'm taking my exams and got the help that I needed. And obviously like I got tutored in the class because I needed to actually get an A like on the next exams because you can't like fail an exam and then like pass that semester. Um and so I just kind of like I didn't let that situation like hinder my ability to continue pharmacy school. I just took it as like a learning point to not pull all-nighters, be adequately rested before my exams and just pay attention. Because I was literally bubbling in, like it would be C and I'd bubble B, and I was like wrong for like the whole like end of my exam. And so sometimes it could be like a silly mistake, and I like would review my exams to make sure that not to get points back necessarily, but to learn from what mistakes I did make to make me a better pharmacist. Because regardless of the score on your exam, which is important, but you would want to know what mistakes you were making and how to avoid them in the future, because we all know that you have to take the NAPLEX. And so as important as it is for that exam, it's even more important for when you have to take the NAPLEX.
Thank you. Akili, go ahead.
For me, the most challenging part getting through pharmacy school was balancing it all. For any if out there, if you are the non-traditional, going the non-traditional route, even have a family, I had a child in well, she was 3 when I started pharmacy school. So it was very, very challenging, but I knew this is what I wanted to do. Joan Hankins, she is a staple in the Temple pharmacy community, and I'm pretty sure she still is. Um,
Yes, she
yes,
is.
so she I can't even count on both hands how many times I ran into her office and said, I can't do this anymore. I'm not, it's too, she's like, no, you're gonna do it. So even with that, like turning a negative to a positive with me just being so hard on myself. I am type A. I wanted to be the best at everything, but just doing my best for that day is just enough. And I think, yeah, balancing it all, and getting through day to day, exam to an exam, semester to semester, year to year. Uh, that PY2 year, man. But yeah, so I would say just give it your best and give it your all, but you have help and you have support to overcome any of those types of challenges. That's it.
Thank you.
Yeah, and
Kevin?
I guess I would just add, I think the hardest thing was just staying organized and being able to keep going through pharmacy school. So I think one of the things that impresses providers the most that we work with is often, that we know so many things about drugs, right? That like there's so much information out there and we just happen to be able to like, it seems like magic. We can pull these like facts from our mind and they're just so obscure or strange or some weird obscure interaction that they've never heard of. And that information has to come from somewhere, right? And that information comes from pharmacy school. So the sheer volume of information that you have to intake, I think by necessity forces you to be disciplined. And I think I learned that the hard way when I started to take my P&T courses. So Achilles said, man, the second year, that's when usually like your therapeutics classes start, right? And you need to just learn so, so, so much. And it can feel overwhelming, right? But it's doable. Like the fact that all three of us are here, all of us are here, right, is proof that it's doable. But it's something that you have to attack with a plan, like a mindset to break this apart into manageable chunks, right, and digest it one piece at a time and not leave it all up to the last second. So, like Nor said, no all-nighters, right? You want to be disciplined and break it down into like a couple hours each day. And I'm sorry, Nor, I'm not calling you out, I promise. It's just like you have to have the mindset that you're going to tackle this monumental task one piece at a time. And before you know it, pharmacy school goes so fast, you're on the other end of it, and then you're staring down the Naplex. And it feels way more doable than it did at the start of pharmacy school when they tell you you're going to take some like 200 question exam that covers every subject in pharmacy, right? So it's both scary but empowering. I see a
I will,
question.
oh wait, I will add Kevin was my resident as well. He was one of the best residents I ever had, actually. My team really liked him. I actually left the clinic to him like very early on. Normally I wait, sometimes by the second week, and Kevin was like, I can go to clinic. I was like, are you sure? And the team adapted to him very, very quickly. And I felt secure where I didn't have to like hover or I knew that Kevin made good recommendations and if he was always secure with his information and if he didn't know anything, he was appropriate. He would say, I'm going to look this up. And the team really trusted him.
I'm gonna blush, Nor, thanks.
I love it. Ananice? I'm
Anaïs.
sorry. Okay. I want to try to get it right. Layara is not easy, so please correct me.
Hi, my name is Anaïs. I'm currently a sophomore. So this is a very common question that I have, but what advice do you have for someone starting out? And my second question would be, um, I have them written down. I have them written down. Uh, okay. My second question is, what skills or experiences are most valuable to develop as a student?
I'm going to say scheduling. I'm just going to tie it to my prior answer about like discipline, right? Like being able to understand, I think that you're going to be doing something that is usually at minimum a 6 year journey, right? Or for some people, even an 8 year journey. In order to tackle something that large, you need to be realistic about the fact that you're going to have to make sacrifices in certain areas of your life, and that's okay because you're going to reap the rewards later. Um, and being realistic about that sacrifice, setting aside time to study, building like good habits early on, and knowing how you're going to tackle, like teaching yourself how to learn is one of the most important skills that you're going to need through all of pharmacy school and through all of residency if you choose to do that and pursue like a career in clinical pharmacy, right? It's almost more important than the rote knowledge itself. So finding the best way that you learn, how can you efficiently absorb information? How much time do you need to set aside to really tackle a subject? I think that all of those things are just critical for developing and growing as a student, but also then as a resident. I mean, it's something that I still apply in my clinical practice every day, right? Like I know that if I don't know something, like how am I going to approach the subject, gather the information, break it down for myself? Because once you graduate, you're still going to run into stuff you don't know all the time. So I think that's the most critical skill for me. But happy to hear from the other panelists as well.
I have two things. One is not to take criticism personal. I know that when I was on my rotations, one of my preceptors said that I really don't know your knowledge base. And I was like, are you calling me dumb? I didn't say that. And I was like, wow. And then I was like, I'm never going to let my preceptor say this about me again. I didn't participate because I thought I just didn't feel confident in what I knew. I looked everything up, but I just didn't feel confident. And then from then on, I didn't take it personal. And it was me and two other students. One of the students took the criticisms personal, and she did not do well in that rotation. I didn't take it personal. And that preceptor actually ended up writing a recommendation for me for residency. Another thing is do not compare yourself to your peers because comparison is the thief of joy. And if you see, oh, well, this person has these grades and they're doing this. No, I actually never discussed my exams with anybody. I would take my exam and then leave. I don't care what you put as the answer. I left. And I think sometimes when you compare, like you'll get in your own head and won't feel as successful, and you're not comparing yourself to yourself. You're comparing to other people, and you could probably go beyond that. And those are two things that I did in pharmacy school. And I actually never told anybody I was applying to residency. I just told the people who wrote letters of recommendation for me. And then when I got it, everybody was surprised. I was like, yeah, because people were going to try to psych me out, or because I didn't do the traditional clinical path. And I realized at the last year I wanted to do clinical pharmacy, but maybe I hadn't set myself up in that way. So I just prepared myself with the preceptors that I knew, and that's how I kept it. And then I ended up being successful, although I wasn't like the prime candidate, like the A+ student. I was average.
I would advise, um, again, being organized, piggybacking off of what Kevin said, but more importantly, know your limitations. That you don't know what you don't know, right? So, and there's no such thing as a stupid question. Always be inquisitive, and those limitations, once you find those, lean into that. Run towards it. Don't be afraid of it because I promise it's gonna come back. It's gonna come back in the field meaning like on your appies and you know and further down in your career. You never want to avoid learning something or mastering something, if you will, because um it's always going to come back. Patients, and as a healthcare professional, you always want to uh dedicate yourself to being a lifetime learner. We learn every day, even in our respective fields. You're learning something every single day. So do not be afraid to know your limitations and attack them and get better at them.
Nais, thank you for your question and thank you for your responses. Did we get to the second part, the second half of your question?
Yes.
All right, perfect. We had a few questions pop up in the chat. What is the most challenging non-clinical aspect of your job? And Rachel will come back to you.
I'm going to say communication. Um, I think that it's probably one of the hardest skills to develop. And it's not necessarily clinically related, right? But it has a huge impact on the way that your recommendations are perceived and received by your team, and whether they're accepted or not. So how do you make recommendations that are both evidence-based, right? And politely sometimes tell people that maybe they're not choosing the best course of action and that there is something like more suitable for the patient or that they've made a mistake or I just think that in general, your ability to communicate with providers, with patients, can you change your communication level from talking to someone who may only have like a fifth grade level education, but you need to make sure that they're going to be compliant with the medication that they're going to take, that they're going to take it the right way, that they're not going to take interacting foods or other medications, and then being able to scale that conversation up to say like a surgeon and explain why maybe they're not choosing like the best immunotherapy for a patient because they may be putting them at a greater risk for a complication. Being able to communicate on all of those levels is probably one of the most challenging but rewarding aspects of the job. It really makes you feel like you're both having an impact on like the ground level with the patients, but also that you're able to impact clinical practice at like a very high level, right? By communicating with other people who also are, experts in their own field, but they're going to take you seriously and take your recommendations. So, yeah.
Thank you. Akila, you wanted to jump in?
Sure. So for me, I think outside of like the non-clinical aspect that's the most challenging in my job is the emotional tug. I work in the clinic, so therefore these patients aren't coming in the hospital and I'm, reviewing their medications and what have you. I am getting to know their grandkids, their kids, and things like that. And when they go through, especially socioeconomic difficulties. There's so many limitations that a large portion of my patient population they're facing right now, and my heart goes out to them. And again, because I get to know them on a personal level, that it's sometimes challenging to separate the two. But you learn, as long as you've been doing it, you definitely learn to separate it and try your best to help the patient, but also you want to be, a listening ear, and you're only one person. You're only one person, and you go in it trying to change the world, but unfortunately you cannot, but you change your world, right? So
Nora, you want to add anything?
Yes, for me, I think working with administration. I think at the Lung Center, it is not just working with the clinicians. I think in order to implement things, I have to work with admin and learning how to make my information digestible for administration to not only hear me, but help me implement what I need to be done. So I think I've had a lot of initiatives within the Lung Center and beyond. And I think learning how to work with administration, and really getting things, whether it's our nursing leadership or the pulmonary administration, because their minds think differently. Like their goals might not be the same goals as mine, but I have to find a way to relate it to them so that I can push things forward and then in the end enhance the patient care.
Victoria, thank you for your question. Rachel, you want to take yourself off mute and go ahead and ask your question?
Okay, so what I wanted to ask was, were there any times that you guys felt like giving up or wondered if it was all worth it? And like, what did you do to keep yourself grounded?
I think I already shared during my pharmacy school experience the many times that I wanted to give up but didn't. But even post grad, even in residency, um, transparency because I want to be an encouragement. I did not match the first round. I didn't match the first round. I ended up matching at Penn State Health St. Joseph the second round of it's called a pharmacy residency interview. So they have multiple rounds. So I matched there the second round. It was not for my first choice, but I made the best of the situation and I had to move away. Again, I was already a mom, but I had to move away for a year. It was only a year because I knew this is what I wanted to do. So there were many times during that year because I miss my family that I wanted to give up. But again, that end goal, man, it was just that driver in me that kept me going. And I knew at the end, this is what I wanted to do. So I didn't let those times, those many times that I wanted to give up really overshadow my end goal.
I think for me, it was during Appy's, one of the rotations that I took was in Hershey. So it's kind of like 2.5 hours north of the city. It's kind of far away from everybody that I know. And I'm somebody who has like never lived by themselves before. So I'm a local kid from North Philadelphia. Now I work in North Philadelphia. So I've kind of been in that geographic area my whole life. And just wanting the stress of wanting to succeed on Abby's, wanting to do my best, trying to intake all this clinical information in a health system far away from home, relatively far away from home for me, was really, really stressful. And there was definitely a point at which I just felt like I don't know if I'm going to be able to complete this rotation, right? At least not feel great about it, right? And I think that during that time, what really kept me going was being able to just drive all the way back. And it didn't matter that it was 5 hours of driving total between like in the span of a day, right? I would drive back and see my parents. I would try to talk to my friends from pharmacy school, ask them how their rotations were going, stay connected with them over Zoom, things like that. So really, I think it's those relationships that carry you forward, that remind you that there are other people who are going through the same thing that you're going. In the case of my friends in pharmacy school, or people who are outside the world of pharmacy who maybe aren't going through what you're going through in pharmacy school, but they can support you, and remind you that there are things out there that you're doing this for. And yeah, that really helped me out. So got through the rotation, obviously, because I'm here. But
Pharmacy school was difficult for me, not easy, but I think the hardest was getting my master's in public health during COVID because I was the COVID pharmacist, but I actually got my master's with one of my old professors at the pharmacy school, Nicole Cifuentes, and we actually motivated each other because there were points where I was like, girl, I'm done. I'm done with this master's. I can't do this anymore. We would be up all night doing our like biostats or writing these like papers, and that was really difficult because I hadn't been in school for I not that long, but I had to relearn how to study, how to like write papers again and meet certain criteria. And it was just very difficult. And during COVID, as a COVID pharmacist, I would have to be looking at like order sets at midnight so that at 7 a.m. the Epic team could come in and like make them go live. So I was like super stressed out. But what helped me during that time was doing it with someone who I looked up to, was like one of like a mentor during pharmacy school, and then her and I doing this together like really helped push me.
Thank you. And Rachel, thank you for your question. We have Teresa. What are some difficulties that you encountered working in clinical pharmacy or as a clinical pharmacist freshly after graduating?
Sometimes knowing when to make a recommendation and knowing when to listen. I think sometimes you have to learn the styles of the different providers. And as clinical pharmacists, like we have a lot of insight, but knowing when the recommendation is appropriate and building that trust with the providers, because not everyone's going to be receptive, and to not take it personal. There are providers who I can make a recommendation and they don't take it, but I'm like, okay, well, I charted it, I documented it, and just building that trust and knowing when to say you don't know something. I wanted to know everything when I started my job at the Lung Center, but I actually went in knowing nothing. I didn't know anything about pulmonary, and it was kind of frustrating because it wasn't the subjects that I had learned in pharmacy school. I was learning about fibrosis, and I don't even think we got a lecture in that in pharmacy school. So then knowing how to listen to the providers and kind of learn what they're talking about and then knowing when making a recommendation is appropriate.
Fear. I'm gonna say the fear of not having a safety net when you're a brand new clinical pharmacist. Even through residency, right? Like the whole goal is to grow your independence, that you're able to like interact with the team on your own, make your own recommendations, right? But you still always feel like you have the supervision of your preceptor behind you, or someone that you're going to be able to refer back to, who's going to kind of sign off on it. So it's not entirely just your own decision. And I think the moment that it really hit me that, oh my God, there's no safety net beneath me, was I made a recommendation in clinic. And I think one of the surgeons kind of looked at me and said, all right, let's go with that. And I said, are you sure? Are you sure? So just that feeling of being, a new practitioner and having confidence, not only like the self-awareness to know what you don't know, right? But having the confidence that you do know what you do know, and the recommendations that you're going to make, like no one else is signing off on them for you anymore. And it's both a scary and empowering feeling, but the more you do it, the less scary it becomes. So I think that was the first difficulty that I really ran into right after graduating from residency, was just making recommendations and then having people unquestioningly take them, which was very scary, but fun.
I did both of those answers, but just having the confidence to say your clinical recommendations with confidence on the floor. It was again during COVID, and at the time we were figuring out in live time how to treat these patients. Like it was interesting times. So you're making these recommendations, and you're like, wait, let me check the guidelines again. Let me figure this out. But no, you know it. But just having the confidence to say it, with confidence, even though so confidence is key.
We kind of got a follow-up question from Victoria to Teresa's question. Do you truly feel you're an expert? And when did you feel you truly were one? So if there was a pivotal moment, I think Kevin started to share when folks didn't question him. But if anyone else want to share any further when they felt that they were the true expert, or if you really feel that you're a true expert.
True expert? N No, again, I'm always learning, but I would say in my clinic, it's the medical director. She comes to knock on my door in my office, and she's like, "Hey, I have this patient. What do you think about this?" And I'm like, "You're asking me what this is?" Again, I've been practicing as a pharmacist for years at this point, and she comes to she comes to my door and is like, "Hey, I see your name in the chart. Like, I wanted to find you and see what you thought about this patient for anticoagulation." And I'm like, "Okay, let's chat." So. I think that was a defining moment in my career as, in the specialty clinic with anticoagulation, like, oh yeah, I do kind of know a thing or two.
Yeah, I'm just going to echo what Akili said. So it was probably the first moment that there was a provider I worked with through all of residency, and I just thought, man, this guy's so smart. Like he knows everything. I don't really even have to help him. I'm just kind of here to learn from him, right? And there was a moment where I was just sitting in clinic and my phone rang, and I saw, I automatically always assume I'm in trouble. I look at the phone and I see it's his name, and I think, oh man, did I do something wrong? So I pick up the phone and he explains his patient case to me, and he just says, I have no idea what to do. What do you want to do? What advice can you offer? And that was probably the moment where I felt like, wow, maybe I am kind of an expert, just a little bit. But the word expert always has an asterisk next to it for me because, like Achilles said, we're always learning, right? And once you get out of residency, once you've been practicing for 1 years, I'm about to hit like 2 years. There's always going to be something new on the horizon that you need to add to your practice. So, do I feel like an expert? A little bit, yes, but at the same time, just very aware that there's still so much out there to learn and add to my game. So yes and no.
Um, I might be a little overly confident, but from my clinic with my experience, my department chair, really supported me very early on when I was the pharmacist for the lung center because we did something that hadn't been done before. And I immediately became confident, was like, oh, well, I really know this subject matter. And I had people that would come up to me and be like, you know the department chair like really relies on you. And he started sending people to talk to me instead of to him when it came to certain medication therapies. And I know there are times where other people might not be able to get to my department chair or certain providers in my clinic, and they'll message me, and I'll be like, oh, they're giving you a problem? I got it. I'll take care of it. Because I've built that trust with them. And even though the person messaging me might know the subject matter better, um, I can relate to my provider. So I think that's something different that I have.
Thank you. These are all really great questions. We have a few extra minutes, so I want to be mindful of that. But I also don't want to close out before all questions have been entered in the chat. If we don't have any more questions now, or you think of additional questions, you can share them with the admissions team. I'll put up our contact information in just a moment, and we'll reach out to the experts from tonight's panel to, just get any more insight they'll may want to share or can share. But I just want to say thank you for this panel. I always look forward to our monthly panels just because of the different topics we're able to tackle, but the knowledge we're able to provide and share with our prospective students. And so seeing a few new names, but also a few names that I was able to meet in person at our in-person open house last Saturday. I'm super excited that you all are continuing your knowledge as you think about your next steps to preparing for your Doctor of Pharmacy journey. So to our panelists, give them a virtual round of applause. Thank you so very much. And if anyone has any additional questions or just has some follow-up that they need, you can reach out to us. Alrighty. So let me just make sure you guys have our contact information. And again, panelists, you were amazing. So thank you so very much for spending this time with us this evening. If all hearts and minds are clear, you all are free to go. Have a great evening, everyone, and thank you. Dr. Rose, did you have anything that you wanted to share, say, before we wrap up?
Yeah, I just
Just
wanted
wanted
to
to
thank our
thank
panelists
our panelists.
for sharing their expertise with everyone, and it was great seeing all of you. Even though Nor and Kevin, I do see you sometimes, but Akili, it was great to see you. I don't think I've seen you since you graduated, but
It's like a little reunion. I love
yeah,
it.
I love the reunion.
All
Well,
right,
thank you so
beautiful
much for having
people.
us.
Thank you. Have a
Absolutely.
good
And happy
night.
holidays. Thank
Thank
you,
you.
everyone.